Now the second lecture for Hijama in English, for Safwa English. We have to know that science of Hijama is one of the most ancient remedies or science related to or dealing with the human body. And I like to describe this science by it is the old and modern, because it's old since Adam alayhi salam and modern all the time until the last day of our life or last day of this creation, until Yawm al-Qiyamah, inshallah. So every day you will find something new in this. You will find something new in Hijama science, and every day increase. We don't want to make fighting between people who say this good and this wrong, and people who accept or not accept, people who believe and people who say that you are liar. Hijama have been fighting too much, and it's time for people to know what a treasure is. Hijama. Hijama is our treasure. Hijama is one of the most important. You know, the prophetic medicine is like a crown of the king. Hijama is the jewelry of the crown. This is what I believe for Hijama, from my work, from my science, from my study and everything, and from hundreds or thousands of people I have been treated all over the world. And Hijama is something good, something for you as a trainer or as a practitioner. You have to do your best to learn. And if you are a doctor, you have to be proud of practicing Hijama in your office or in your clinic beside your work, because you will find that it's very nice. Some cases before you become you feel hopeless dealing with these cases, and when you start making Hijama beside your medicine, you will find the difference. Of course, you'll find a great difference in many diseases. Before I left this period, I left this experiment. Some cases, for example, in my specialty, I'm Dr. Abdelnasser Towhid. I am medical doctor dermatologist in my field, Mansoura University. I graduated from Faculty of Medicine, Mansoura University, Egyptian. This is my name. I'm sorry, I didn't introduce myself to you all. But sometimes some people came, for example, complaining to me from eczema, from psoriasis, from some disease who cannot deal with this disease except cortisone, cytotoxic drugs like this for many time, and make blood testing, organ testing each time, because we are afraid that the medicine we give this patient make destruction in his body inside. And when I started to do cupping therapy Hijama, I find fantastic results. For this reason, I concentrated on Hijama in my research, in my work, in my study, and now I'm working only Hijama. I treat dermatology by Hijama, rheumatology by Hijama, gastroenterology by Hijama, cardiology by Hijama, everything. We can do a Hijama in everything. So what I dream for, that Hijama will be a medical specialty, that every doctor, every medical doctor, or every medical student study Hijama in his faculty, and he can choose. He has the freedom to choose Hijama, one of the remedies of treatment beside his specialty. I mean that, for example, orthopedic doctor can learn Hijama. When he knows Hijama, some cases can treat them by Hijama in his clinic, and some cases need surgery, some cases not like this. for example, for all medical specialists, and this is my dream. Not like this. Maybe I dream that there may be a specialty in hijama itself. I dream that, for example, centers open for hijama for knee joint, for example, only treatment, or hijama for bone disease, or for rheumatology disease, for example, hijama for cardiac disease, hijama for headache, hijama for obesity, something like this. This is my dream, and I hope inshallah it will be, inshallah. So the aim for this Safwa group as a whole and Safwa English, how to reach the degree of professionality in practicing hijama without mistakes and with your best effort. So we want to reach professionality in practicing hijama, no mistakes, and with our wills and good effort. There is many cleverness in hijama practice. If you want to make hijama, you have to gain or to own this cleverness. You have to be clever. What's mean by clever? You have to gain some concentration in your mind, some knowledge in your heart and mind, some manners, okay, and some science and some mind. So the people, we wish that they will be the first to interest in coming therapy courses or in hijama courses. I hope these people will be doctors, paradoctors, medical doctors, nurses, pharmacists, dentists, and like this. And also anyone working in the field of hijama, he can get a good benefit from these lectures, and we open these lectures now for you. Many research is done in hijama therapy to teach you how to do hijama by a good way, clean way, developed way, to make benefits for yourself and for people. And hijama developed by time and by place also. Your internal organs, you have to know some idea about your internal organs. You have to know that hijama, which diseases are suitable to be treated by hijama, and how to reach for some sort of diagnosis for the affected organ. And you have to know also that hijama have been approved that it could treat many diseases that modern medicine could not, and this occurs. This doesn't mean that we tell you give an interest in hijama, and when a patient came to you, tell him خلاص don't do hijama, don't take your medicine, stop your medicine. No, this is wrong. You know why? Because we say that we need manners. We need sayings. Okay? Our manner prevent us to tell any patient coming to you to tell him stop your medicine and only hijama and let him pray for hijama. No, hijama is one of the most important remedies in our public, in our prophetic medicine, or in our popular remedies to treat disease. And this doesn't mean that hijama is everything. Hijama can treat some disease. Hijama can help modern medicine treating some disease also. Hijama also can be as a good way for prevention against some disease, and hijama also cannot affect or can cause many diseases also. So you have to know the perfect way to evaluate your situation. And you have to know that our aim from this training courses or Al-Safwa courses, all Al-Safwa courses and Al-Safwa English, is how to reach the professionality in practicing hijama without mistakes. And you have to know that hijama science is one from the sciences that could be learned easily. I can see that it is some sort of the difficult easy science, okay, but you will feel very you will feel very happy when you try to study or to know more about hijama, I think. And if you know, the medical research or the research in hijama differs than research in any disease or any medicine or anything rather than hijama. For example, if you're making a scientific research for some drug or a certain drug, you only need you make research for this drug at the level of pharmacology, pharmacokinetics, for example, like this, and pharmacology as a whole, and physiology, and little about anatomy or pathology, like this. But for hijama, if we make for example, the effect of hijama related to for a certain disease, this needs a research at the level of medical research. We can take also the holistic medicine research, Chinese medicine research, prophetic medicine research. It needs much more authorities or much more institutes, or needs more possibilities to make this hijama research. So our aim of teaching hijama to people is not to give you a certificate, no. And I'm sorry if you coming to ask me, you know, I myself, some clients call me asking me, for example, doctor, you make a training course, something like this, from where these certificates come? I tell them, you are not I will tell him, you are not my target client, because you don't ask me about the perfect teaching way of hijama. You don't tell me about, you just ask about the certificate. Okay, if you want, wallahi, I swear, qasam billah, I swear, I tell him like this: if you need a certificate, the market is full of certificates. We don't do hijama hijama workshops or hijama training for certificates. Our aim is not the certificate. Our aim to give you an academic study. You have to do some effort, and you have to do your best to gain the knowledge, and after that you can go to gain any certificate either from me or anywhere. This is no problem. If your country make test for practitioners to practice hijama in Ministry of Health, for example, after Safwa training courses, you can easily pass, I think. But if you want certificate, just pay money, $200, $2,000, something like this, to take a certificate. Khalas, you can go many authorities. You can bring a certificate from anywhere. But you are not my target client. You are not my target trainer. You are not my target hijama therapist. And if, for example, we give you a certificate, for example, for Safwa official training courses, the certificate is not a scientific degree. It's not scientific degree. It's like an experience that you have been attended a training course a training course, and it doesn't mean that is an educational degree. Who told you, or who will tell you that you will take a degree, it will make you a doctor? This man is liar. This man is liar. He tell you that he can give you diploma in hijama. This man is liar also. Nothing like this. Nothing like this. Diploma means, diploma is a degree. Diploma is an educational degree. How can you go and take, for example, 3 days, 4 days training course in hijama, and after that you take a certificate under the name of diploma? You are liar. Who gave this, uses certificate also is a liar. Okay? To take a diploma or something like this, or master or something like that, you have to study in a university, and you have to take your time, at least 1 year for diploma, and under authority or under from a known and accredited university to give you this diploma. But someone making an academy or a training center, something like this, give you diploma, short diploma, no, nothing. These are all kullu haram. This is not good. So it's called the training certificate, that you have attended the course from day, for example, day 1 to day 4, from day 1 to day, from months, from April to December, like this. For this, we need, we said that we have to gain some Islam in our hearts. We have to get some manners. But if you do, again at this point, you lack this manner, so you will not be effective. You will not be clever hijama therapist. You have to be, you have to speak in, you have to speak to yourself and to be clear with yourself. This training suits also, or this training courses for doctors also is considered new science, and I encourage my colleagues, doctors, medical doctors and paramedicals all to give some interest. Please, you will enjoy this, and you will get a good benefit from this, and you will be happy one day from this. And in our training institutes, we make an exception. The exception is that cupping practitioners or people who do hijama practitioners which are licensed in their countries, either legitimately or by law or by authority or by thing like this. So what about hijama? Hijama, it means that if you make hijama for anything, this means that you will suck the thing, like a baby sucking the breast of the nipple of the breast of his mother. Is hijama is sucking in Arabic language. The cupping practitioner is called al-hajjam. The cupping process is called hijama. And the instrument we do cupping is called mahjam. The cup, mahjam. And the people or the patient you do cupping for him is called al-muhtajim. So the cupping therapist is a doctor, one of two, either the doctor who make hijama or the person that hijama practitioner, the person that is doing hijama. Hijama scientifically is considered a way of healing, a good way for healing, that doctors or hijama practitioners try to attract the toxic material and toxins from inside the deep tissue of the body to the surface of the body to get rid of this, get rid of it. يعني يخلص منها طلعها برا. ده تعريف كلمة حجامة علميا لغويا. But hijama, if you understand hijama well, it's more than this. Of course, more than this. There is some toxins was called, or some mixtures inside our bodies called أخلاط. هذه الأخلاط, these mixtures cause disease. So there is mucus mixtures, there is yellow mixtures, there is blood mixtures, there is black mixtures. The mucus mixtures is related to the brain and related to, يعني if we can describe this, we can say that these four mixtures inside our body, we will start from, for example, the mucus related to the brain disease, and from the seasons of the year, the winter, and related to water. Okay, yellow mixtures related to summer, fire, and liver. Blood mixtures related to earth, spring, heart. Black mixtures related to air, autumn, spleen. And in between yellow and red mixtures there is heat. And between red mixtures and mucus is humidity. In between the mucus and black mixtures is cold. In between the black mixtures and yellow mixtures is dryness. So the health problem that the patient complain from, these mixtures are inside our body in what's called in harmony. If this harmony have been broken down or affected, diseases start to affect the integrity of our body. So these mixtures are present deep in our bodies. By the cupping process, by hijama, we attract these mixtures outside according to the nature of the disease. Is related to yellow or blood or mucus or black mixtures like this, according to be accumulated in the most superficial area of the skin. And after that, when we mix clarifying or sacrificing this, cut the skin, the superficial area of the skin, or by mean of pain breaking, we take this, or we exude, or we attract these mixtures outside the body by the negative pressure we're making, or by the text, or by the cup. So hijama is an important way dealing with this point also. And cupping therapy, hijama, in legitimacy of cupping therapy, يعني by legitimate way الحجامة أو شرعية الحجامة. Hijama is a good and way for treatment, and frankly and 100%, the patient who are going to make hijama, he will get a certain benefit, and it's some sort of a remedy that al-wahy or our Prophet Muhammad sallallahu alaihi wasallam have been advised from Jibreel, from Allah, that to treat his fellows in his believers with hijama. عن ابن عباس رضي الله عنهما قال قال رسول الله صلى الله عليه وسلم ما مررت بملأ من الملائكة ليلة أسري بي إلا قالوا عليك بالحجامة يا محمد. وفي رواية أخرى ما مررت ليلة أسري بي بملأ إلا قالوا يا محمد مر أمتك بالحجامة. This our Prophet Muhammad sallallahu alaihi wasallam in Laylat al-Isra says that when he passed in front of any angels in the night that have been taken to the Masjid al-Aqsa, he said all angels tell him Muhammad mur ummatak al-hijama, Muhammad order your fellows or your people or your nation to do hijama. وعن سلمى خادم رسول الله صلى الله عليه وسلم قالت ما كان أحد يشتكي إلى رسول الله صلى الله عليه وسلم وجعا في رأسي إلا قال احتجم ولا وجعا في رجليه إلا قال اخضبهما. No one complained to Prophet Muhammad صلى الله عليه وسلم from headache, and he except no one tell him from headache, and each one Rasulullah صلى الله عليه وسلم tell him do hijama. Okay. عن ابن عباس رضي الله عنهما أن النبي صلى الله أن رسول الله صلى الله عليه وسلم قال الشفاء cureness in 3 honey drink honey, شرطة محجم scratching by حجامة, كية نار fire cautery, وأنا أنهي أمتها الكي, and I order my people not to do cautery. رواه البخاري في الصحيح. وهذا من أصح, and this is the most important hadith come in hijama, and this hadith make hijama had the third of cureness in our religion, or our legitimate site for hijama. And also nothing have been approved from our Prophet Muhammad sallallahu alaihi wasallam to prevent us that don't do hijama in this day, something like this. خلاص لم يثبت عن النبي صلى الله عليه وسلم أنه عن وقت الحجامة. You can do hijama anytime. For example, only one hadith came for this, أن رسول الله صلى الله عليه وسلم قال من أراد الحجامة فليتحرى 17 17 19 or 21 لا يتبيض دم بأحدكم فيقتل. حديث صحيح. أوكي. أيضا في الحديث أن الرسول صلى الله عليه وسلم قال أن يستعين بالحجامة عند تبيض الدم وفرانه، وده ممكن يحدث في أيام ملاش علاقة بال17 ولا 19 ولا 21. إذا المريض يحتجم في أي وقت وبالرخصة، ليس على المريض حرج طبعا. وفي رواية ابن عباس أن رسول الله صلى الله عليه وسلم احتجم وهو صائم، احتجم وهو محرم في رأسه من شقيقة. خلاص. وعن ابن عمر رضي الله عنهما قال النبي صلى الله عليه وسلم يحتجم في رأسه ويسميها أم مغيث، وهكذا. إذن ده بالنسبة لشرائط الحجامة، هي من الحاجات التي أوصى بها النبي صلى الله عليه وسلم وأمر بها أمته، وهي من الوسائل العلاجية المهمة والتي أفرد النبي صلى الله عليه وسلم لها كثير من الوصايا والأحاديث. ويجب أن نعلم أن حجامة المريض the hijama for any patient not related to certain time or certain place, and it's a medicine for all peoples, under all religions, all species, and it have been succeeded all over the world as a whole. So you can treat Muslims, non-Muslims, non-religious, anything, even animals could be treated by hijama. And hijama, even if time differs and the place differs, finally hijama, it's coming to do well in treating a certain disease by a certain way, by certain mechanisms. So If you want to make hijama for a patient, you can do hijama for a patient anytime, anywhere,